Good morning. Thank you very much for the kind introduction. And congratulations on the hosting of the first ever European Aligner Society. I'd like to extend my thanks to the President, Dr. Graham Gardner, and Dr. Les Joffe, and Dr. Francesco Garino, Dr. Tommaso Castroflorio, and Alain Scott for making this wonderful opportunity possible. The possible of the aligner orthodontic treatment are expanded every day, drawing the attention of the orthodontics from around the world. My name is Kenji Ojima. I'm to private practice in Tokyo. I specialize in treatment using the Invisalign system. This is our Invisalign team. いつもありがとうございます。Okay. The literature and the presentation from around the world tell us that the range of the possible treatment with aligner orthodontic has expanded beyond the case of the mild clouding. In recent years, development of the various different accelerated orthodontic devices has caused a paradigm shift in aligner orthodontics. As a result, more difficult treatments that require complex tooth movements, such as full premolar extraction case, molar distalization, lateral expansion, and the TMD patient approaches have become possible through the precise control granted by Invisalign system. This is a program for the 2016 meeting of the American Association of Orthodontists. The number of the presentation about accelerated orthodontics is increased every year. This fact tells us the number of the cases and the patients who need accelerated tooth movement orthodontic treatment is also increased every year. By combining the Invisalign system with an accelerated orthodontic device such as Accel from Ortho companies, the number of the days required for each aligner is decreased and more complex tooth movement control become possible. You can see more detail in the exhibit booth. You can check it. Normally, as you know, Invisalign aligner is changed 2 weeks. However, use Accel, it takes 5 days change for Invisalign aligners. I have experience of the 650 cases using Accel with Invisalign system. In today's presentation, I will introduce several examples for the complex case which require a large amount of the movement, 6 cases. The first case is, I will show you the upper molar distalization, non-extraction case. The case 1, 25-age female patient. Chief complaint was overjet, severe overjet. I planned non-extraction and the distalization upper molars. Total stage, total aligners, number 72 aligners. Normally, it takes 36 months, have to need, but I use Accel. Total treatment time, it took only 30 months finish. Have a look. This is extraoral photos and safe. The initial clean check. Please have a look clean check. As you can see, all the molars distalization, then premolars and canine. The first aligner set. The 1 month later, attachment on. The started distalization, second molars. The first molar distalization. As you can see, create a space between molar and premolars. Premolar distalization. You can see create a space between premolar and the canine. Canine retraction. The space for the canine to anterior region. Then anterior retraction. This is the final situation. As you can see, the solved severe overjet and the improved class 1 relationship canine and molars. This is the final clean check. Initial and final. The superimposition. As you can see, the molar bodily movement achieved and the retraction for the severe overjet. The next case is for premolars extraction. So this bar mean is upper bar is a normal speed, and the second green bar is acceleration treatment time. This patient, 27 years old female patient, total aligner is 72. Normally, it takes 36 months, but using Acceleradent, it takes only 30 months finish. Initial, the safe, the clean check. Have a look clean check. In my protocol, no need wires, no need another material, only Invisalign system with Acceleradent. The post-extraction, attachment on, the leveling on the canine and the retraction. Anterior retraction started. Detailing. This is the final situation, the clean check. I will show you montage treatment time. This is the initial, the post-extraction. The attachment on, the started for the space closer, the control canine, the detailing stages. This is the final situation. This is extraoral findings, the before and after. Profile, before and after. The safe. Let's have a look at the superimposition. The maximum anchorage is achieved. No tipping. The next case is expansion case. The case 3, 26 years old female patient. Chief complaint is anterior severe clouding. I planned non-extraction treatment. How about a clean check? The very severe clouding anterior region, but a very good control for the aligners only, with Acceleradent. We solved for the anterior region clouding, so the upper and the lower arches for the expanded. This is the first aligner set. Attachment on. Then expand. This is the final situation. The midline is correct and improved anterior clouding for only aligner with axial dent. This is the final clean check. Initial and the final. This is OPG, no root resorption. The next case is a class 3 lower molar distalization case. This patient, 28 years old female patient, chief complaint is class 3 situation. The first visit our office, I told you this patient have to need the surgery approaching, but the patient don't want for the surgery approaching. Then we try to using the TART with Invisalign with axial dent system. As you can see, the canine and molar relationship is a full class 3 and anterior open bite. This patient, normally it takes 33 months this patient have to need. However, I use axial dent, it only took 50 months finish. Initial. The SEF and the OPG. Initial clean check. The first clean check, as you can see, significant class 3 molar relationship, both of the side. Have a look clean check simulation. As you can see, total 65 aligners and neat distalization lower molars. This patient, the 37 and the 47 have to need 4.0 millimeters distalization. The first molar is same, the premolar is same. The attachment on 1 month later, the started lower molar distalization. As you can see, space between first and the second molars. Okay. I use for the TART the post-premolar distalization. Simultaneous retraction, they use mini screw. This is the final situation. As you can see, improved anterior open bite and achieved full class 1 relationship canine and molars, both of the side. The OPG, the compared region, initial and the final OPG, no significant root resorption. Extraoral findings, initial and started for the refinement. This is the final. Superimposition. Okay. Next case, the CMD patient. This patient is a 27 years old female patient. Chief complaint is neck pain, back pain, and aesthetic. This is the initial oral photos. As you can see, this patient, the mandibular deviation shifts to the left. This is the OPG. As you can see, missing lower first molar, then using for the bridge, the both side, and the condyle deviation shift to left. cone beam CT, right condyle significant forward on the centric occlusion, the position. The patient has a pain in this area, the joint, the muscle, and the head. So we have to need orthopedic treatment first, then tooth movement. I started first spring therapy for improve the condyle-centric relation position. This approach learned from Dr. Werner Schupp. Vielen Dank. Using splint, that name is copper with CR position. With copper, patient lower jaw midline is correct. And during using the splint, patient was pain-free. Every 2 weeks, we check on the adjustment for the copper splint in my office. After 3 months, the patient completely pain-free. Then we take cone beam CT checking condyle position. The joint for the position. The after pain-free position improved. We made a new bridge as such as same splint height. Insert new bridge of keep same height, the splint with pain-free position. Then we take iTero scanning. This is the clean check for Invisalign at the first phase treatment. This case, using Axodent, we change the aligner every 5 days each with Axodent. Normally, it takes 40 months. However, using Axodent, it takes only 6 months. Important thing in this case is keep molar relationship because this position good for the joint. Where the first aligner Invisalign orthodontic treatment start? The end of the first phase treatment. Keep vertical height, pain-free position. This is the end of the first phase clean check. And so we separate on the pontic lower molars bridge. Then rescanning iTero. This is the refinement stage of the clean check. Normally, it takes 22 months. However, we use Axodent, it takes only 8 months finish. This phase 2, I control, as you can see, the premolar, lower premolar mesialization. Lower second premolar, perfect mesialization only aligner. Final situation of the clean check. In the case Invisalign orthodontic treatment, times is only 40 months. We create a space for Invisalign. Then I send to the prosthetic dentist and take OPG and the CT scanning. The post-implant surgery. Interdisciplinary dentist set final restoration. Final. As you can see, the midline is correct. The class 1 relationship is achieved. This is a final for the extraoral findings. The facial midline shift is completely improved and ideal guidance for the achieved. And no pain-free position. The next case is the final my case, the using Orthopulse device. The Orthopulse device is already, Marco is a wonderful lecture. Thank you very much. Vielen Dank. Then I'm just only the clinical report. The case 6.
Just 1 more minute.
Okay. Just a little bit faster. They have to need a 50 aligners, 50. Just a little bit severe crowding. This is the clean check. Just a little bit skip. Initial and the final. This case only 6 months finish. Initial and the final. No root resorption. The conclusion, aligner orthodontic can solve the difficult orthodontic treatment based on the good diagnosis, planning, and the treatment. Using accelerant device can support that possible good tooth control with aligners. Accelerate device become reduced treatment time and pain. Thank you very much for the, in 2040, we founded the Japanese Academy of Aligner Orthodontics, and we hosted 2 congresses since then. In 2040, 200 orthodontists attending. And last year, 2050, attending grew up for the 280. This year, the 3rd JAO Congress will be held on the December 1st and the 2nd. So the place is the University of Tokyo. I hope you all will join us. Thank you. Thank you very much.